Okay.
Amen.
Thank you, Miss Winifred. So by way of recapping, can anybody tell us what we learned last week? Just a summary of what we learned last week. Miss Winifred, is your hand still up or is the previous? Miss Winifred? Anyone to give us a summary of what we learned last week, please?
Okay, madam.
Okay, Miss Victoria, aye.
Yes, sister. Please. About last week we talked about nursing as a discipline with two unique aspects. A body of knowledge and the application of that body of knowledge through clinical practice. And we said that knowledge is an experience or skill that is um, acquired by an individual through formal or informal learning. Thank you.
Thank you very much, Miss Victoria. Mr. Ebenezer Opon. Mr. Opon. Okay, Mr. Nicholas.
Hello.
Yes, please.
Yes, we talked about the sources of knowledge. We talked about the sources of knowledge in nursing theories.
Okay. Let's take the last one from Miss Winifred.
Okay, please. We also talked about the sources of knowledge. This is the traditional knowledge. That's the knowledge that's being passed down from generation to generation. Then we have the authority. We have the authoritative knowledge, which is the knowledge that is gotten from an expert and someone who specializes in that field without questioning the person's submission. Then scientific knowledge is the knowledge gotten from research, scientific research.
Okay. Can we take the last contribution from Mr. Daniel Akologo?
Okay, good morning, madam.
Good morning.
We continue to talk about types of knowledge, of which we said we have three types of them: science, philosophy, and then process. Then define them, of which you said science implies a body of knowledge. Science is observing, identifying, describing, investigating, and explaining events, occurrences that perceive in the world.
Okay. All right. Thank you. So basically, last week we started looking at, as they have said, nursing as a discipline, and then we said nursing as a discipline is made up of two main aspects. So we have the knowledge base and then application of the knowledge through nursing practice or clinical practice. So today we are going to look at what a theory is. We'll discuss the components of a theory. We'll look at the characteristics of a theory and then the relevance of theory in practice. Then if we still have time, we'll look at what nursing theories are. I'm going to share my slide. Okay, so when we say a theory, who can tell us what he or she understands by theory? A theory. We've all heard of theories before. Williams Nana Tando.
Hello, sir.
Yes, please.
For my understanding of theory, I would define theory as an idea or a conclusion that has been drawn from an analysis of data.
Okay, an idea that has been drawn or a conclusion that has been drawn after one has analyzed a data. Okay, thank you. Jidifo Ahiable. Sorry, I don't know if you are Mr. or Miss, so I'm unable to add the title.
Maybe I wouldn't.
Is Jidifo Ahiable.
Okay.
Yeah. So, my
please, we can't hear you.
Yeah, hello.
Yes, please.
Yeah, to me, theory will be a system of ideas that are intended to.
Can you please come again?
Okay, I said theory is a system of ideas which are intended to explain something.
Okay, thank you. System of ideas intended to explain something. Okay, let's take the last one from Miss Florence.
Madam.
Yes, please.
Theory is an idea used to account for a situation or justify a cause or an action.
Theory is an idea used to justify
a cause or an action.
A cause or an action. Okay, so we all have the idea about what theories are. When we say a theory, it's a set of concepts, definitions, assumptions, or propositions to explain, describe a pattern of reality or a phenomenon. So when we have want to explain a particular situation, please hold on, let me mute all of you.
Amere. Mfumo.
So a set of concepts, we look at what a concept is. We look at what we mean by assumptions. We look at proposition. When we say a theory, just as they try to explain, one of your colleagues mentioned that after you've carried out a research and then you want to use your finding to explain something, that can be said to be a theory. So a set of concepts or anything that describes a pattern of reality or a phenomenon is what we term as a theory. So theories usually serve as roadmaps or maps. They help guide in given situations. And then you bear with me that a theory which may be applicable at a given situation, let's say in an emergency situation, at the A&E, a theory that you apply there might not necessarily be applicable at a medical ward or any surgical ward. So theories are specific to given situations. And then theory comes from the Greek word theoria, which means to speculate, So to help us to understand what theory is, we have to look at the various parts or components of a theory. what comes together to make a theory. So there are several components of a theory. We have what we call phenomenon, concepts, definitions. Then we have assumptions. So take them one after the other, and then we'll understand what each of them means. So when we take phenomena refers to things that we witness through our senses, aspects of reality that can be perceived. So when you can witness a situation, in a given situation, when you are able to witness it through any of your senses, then we'll term or refer to it as a phenomenon. So let's say that a patient falling, you see a patient falling, it's a phenomenon. You see that the floor is wet, that is another phenomenon. So anything you can witness through your senses or aspects of our reality that we can perceive is what we term as a phenomenon. So can anybody give us an example of phenomenon? We are looking at a theory, and then we are saying that theories serve as a map. They help guide, they serve as a guide in giving situations. And then we also mentioned that theories describe phenomenon. And to help us understand better what theory is, we have to look at the components of a theory. And the first component is what we are discussing, which is a phenomenon or phenomena. And we are saying that phenomenon refers to situations that we are able to witness through our senses. And I've given a typical example. And when I see a patient falling, that is a phenomenon. So I'm asking for examples of phenomenon. Okay, so Mr. Ahiable, please, you can unmute and then talk.
Okay, sister. Witnessing an accident or RTA will also be
witnessing an RTA is a phenomenon. Thank you. Mr. Gideon Asari.
Please, COVID-19
Please come again.
is a phenomenon.
Please come
is a
again.
phenomenon. COVID-19 is a phenomenon.
In what way, please? We are saying that a phenomenon is a situation or let's say something that you can either see, you can touch, you can feel. So I want to understand what sense or what aspect of COVID-19 makes it a phenomenon.
The patient having a difficulty in breathing.
Patients having difficulty in breathing. Okay, yes, that is a phenomenon. Okay. Let's take the last one from Mr. Adoliba. Sorry if I don't pronounce your name well. Please, can we hear from you?
Witnessing a patient undergo an adverse effect of drugs.
Okay. Witnessing a patient undergo adverse effects of drugs. Thank you. So that is a phenomenon and it's one aspect or it's a component of a theory. Now let's look at the next component. Once we have a phenomenon and then we try to put a name to the phenomenon, it no longer becomes a phenomenon, but it becomes a concept. So concepts tend to encapsulate what a phenomenon is. If we can define the concepts, they help clarify our view of the phenomenon. So we are saying that for phenomenon, it has to do with reality that we can perceive through our senses. And then we are saying that when we are able to put a name to a particular phenomenon, it no longer becomes a phenomenon, but it becomes a concept. So we'll look at examples to help us understand. So according to Chain and Kramer, Concept refers to a complex mental formation of our perceptions of our world. So after you have observed something, how you are able to perceive that thing through your senses is what we refer to as a concept. So let me give an example, then you also come out with your various examples. I see someone being pricked by a needle. When I see the patient has been pricked by a needle, that situation is what we refer to as a phenomenon. Now, when I'm able to put a name to the situation that the patient has been pricked by a needle, then that gives me my concept. So what happens when someone gets pricked by a needle? You and I will testify to the fact that there will be a sensation of pain. A sensation of pain. So when I'm able to say that the patient is in pain because of the needle prick, the sensation of pain now becomes the concept. I've been able to put a name to the phenomenon, which had to do with the patient being pricked by a needle. Please, are we getting it? I've muted all of you. So that is a typical example. So a concept labels or names a phenomenon, an observable fact that can be perceived through the senses. So when someone gets pricked by a needle, one word that we can use to describe the situation is a sensation of pain. So the sensation of pain now becomes a concept. So please, can we have more examples of phenomenon? Then we derive concepts from it. Anybody to try? I can see some hands raised. Okay, so, it's the same people who are contributing. Please, contributing or participation in class also attracts a mark. All right, so Miss Mavis Azuma, so you give us a concept and then you give us a phenomenon first, and you derive a concept from the phenomenon. So Miss Mavis. Miss Mavis, please, you can talk.
Sister.
Yes, please.
Please, when I see the signs of convulsion, like a child convulsion, so the concept will not be convulsion.
Okay, so you've seen the sign of, so what sign?
Like
What
the
sign?
the jerking and then the foaming. So the jerking that's the phenomenon, what I'm witnessing. Then with the concept, the child is having convulsion.
Okay. All right. Let's take another example from Miss Florence.
Madam.
Yes, please.
When the patient has vomited more than 6 times, having diarrhea more than 6 times, that's my phenomenon. Then the concept, the patient is having dry lips, sunken eyes, is dehydration. The patient is dehydrated.
Very good. Thank you, Miss Florence. Okay, so Mr. Adoliba. Mr. Adoliba. Miss Rose Teki Lamte. Miss Rose.
Madam.
Yes, please.
My concept is when a patient is in respiratory distress with chest indrawing and cyanosis, and then I check SpO2 and it's low too, then I'll say patient is having hypoxia.
Okay, so the first part is the phenomenon. The first aspect of is the phenomenon. Then hypoxia now becomes the concept. Okay, so let's take the last two. Thank you. Let's take the last two. Mr. Albert Saki.
Hello, sister. The patient having offensive discharges from the wound. Will be my phenomenon, and the concept will be infection.
Very good. Very good. So a patient having discharges from the wound, that will be the phenomenon, and then the concept will be wound infection. So let's take the last one from Mr. Martin. Mr. Martin Abalu.
Yeah, observe someone had accident and is bleeding from an artery. The phenomenon, that's the phenomenon. And then the concept is the patient ran into hypovolemic shock.
Okay. So here, the patient is not in shock yet, or?
Yes, observing
so
the client.
It will be at risk.
Yes, okay, higher risk.
Yes, yes. Okay, I'm glad we've all understood the difference between the phenomenon and then the concept. So let's move on to the other components of a theory. So now the next component we have is proposition. Proposition. So with proposition, when two or more concepts are linked, it is called proposition. So it is a statement that explains the relationship between two concepts. Statements that explains the relationship between two concepts. So I'll give an example and then I'll welcome more examples from you. So the obvious proposition from one of the concepts introduced earlier would be the link between a wet floor and a patient falling. So now I have when we have a wet floor and then a patient falls, we can link the two, that the patient fell because of the wet floor. The patient fell because of the wet floor. So in effect, the proposition links, if it kind of links two phenomenon together, it helps to explain how two phenomenon are linked together and then how one can lead to the other. So that is what the proposition does. So given two phenomenon of, let's say, a wet floor and then patient falling, we can kind of deduce or come out with a statement that the patient can fall or the patient fell due to the wet floor, and that becomes our proposition. It is explaining the relationship between two phenomenon or two concepts. So please let's take examples of propositions. Okay, so Mr. Mokdo. Hello. Hello. Hello.
Can you hear me?
Yes, please.
I said, patient runs into hypovolemic shock due to RTA.
So it will be due to the excessive bleeding, rather.
Yes.
Okay. All right. So he has given us two concepts or two phenomenon. We have the excessive bleeding, and then we have patients running into shock. So the link here will be that the patients ran into hypovolemic shock due to excessive bleeding. Okay, let's take another from Mr. Derek.
The patient's heart ceased beating due to high level of labetalol administered.
So please let us know what the phenomenon phenomena are before you link the two.
So the labetalol, the high dosage of labetalol is that will be the For the preposition, we are saying two. When you get two concepts, that will link together.
Yes. So with the high dosage of the medication, did you observe it? Was it observed, or how did you know that a patient took in high dosage of the medication?
Okay, then an opened needle a patient has a needle prick due to an opened due to a patient has a needle prick due to lack of maybe safety box.
Okay, so let's say after a procedure, the nurse forgets to discard off the used needle, and then leaves the needle, and then the patient gets pricked from the needle. So we can have the concept of pain, and then we can link it with the fact that the patient is in pain because the patient got pricked by the needle.
Okay.
All right, please, can we have let's take 2 more examples then. Please give me some few minutes. Okay, so please let's take the examples. Mr. Azizu.
Okay, a patient seen restless in bed, is heard wailing or shouting to be in pain.
Please come again.
A patient seen restless in bed begins to shout or wail of being in pain.
Okay. So what's the give us the phenomenon or the concepts, and then let us know how they are linked together.
The patient is seen being restless.
Okay.
And patient shouting is heard shouting of being in pain.
Okay.
Yeah.
Okay. All right. Thank you. Let's take the last one, then we continue. Miss Rita. Miss Rita. Mr. Solomon Akaku. Mr. Solomon. Is Mr. Solomon with us?
Yes, please. I'm on the line.
Okay.
Profuse vomiting leading to dehydration.
Okay. Okay. All right. So that is another components of a theory. Then we have, okay, so there are more examples here, linking the concept of helplessness and the concept of loss. We can state it as multiple and rapid losses predisposes one to feeling of helplessness. So propositional statements in a theory represent the theorist's particular view of which concepts fit together and how concepts affect one another. So I mentioned the other time that we will be having our presentations. So when you take your theory, when you are describing the theory, if the theorist mentioned some propositions or if there are some concepts in the theory, you have to let us be in the know. The next component is assumption. Assumption. We all make assumptions. So an assumption is something that you accept as true, even though it has not been tested. An assumption is something that you accept as true, even though it has not been tested. So can we get examples of assumptions? We all make assumptions. Assumption is something that we accept as true, even though it has not been tested. Examples of assumptions. Can anybody give us examples of assumption? Okay, Mr. Gideon Ofe Asari.
Sister, please, when a patient is having his vomiting, sometimes we can say the patient is having severe malaria.
Okay. Okay. We might have not even conducted any laboratory investigations.
Yes,
but
please.
Just assume, make assumptions that the person has that particular condition. Okay. Even in, can we also get some examples in our day-to-day activities? Taking us, if we take ourselves out of the word, in our daily activities, some assumptions that we make, which has not been tested, but they are considered as true. The same hands. I keep seeing the same hands. Mr. Solomon Kwam. Mr. Solomon Kwam. Okay, if he's not ready, Miss Mavis Azuma. Miss Mavis Azuma.
Sister.
Yes, please.
Please, we assume that all guys with dreadlocks smoke weed.
But is this assumption always true?
It's assumption.
It has not been tested.
See, we are saying that something that you accept as true, even though it has not been tested. So is it something that we have all accepted that all people in dreadlocks smoke? Well, to some extent.
Yes,
to some extent. Yes. Okay. Miss Agnes. Miss Agnes.
Yes, please. Please, it is assumed in our society that if you see a young lady within the childbearing age vomiting, it indicates that she might be pregnant.
Okay. All right. Thank you. Miss, let's take the last one from Miss Esther. Miss Esther.
Yes, madam. Please, we assume that when a patient comes to the hospital for complaining of severe headache for a number of days and then vomiting, meaning he has TLT to be positive.
Okay. All right. So all these are assumptions. So, in researching for your presentations on your theories, you would realize that some of the theorists do make certain assumptions. Okay. So just as we said, we've defined a theory that a set of concepts, definitions, and propositions. Now we've gotten to know what concepts are. We know what propositions are. So in theories or in defining a theory, we say it's a set of concepts, propositions that project a systematic view of a phenomenon. Over here, relating it to our profession, the phenomenon here can be nursing. So a set of concepts and propositions that project a systematic view of our profession or of the nursing profession. So simply put, a theory is defined as a belief or policy or procedure proposed or followed as the basis of action. A belief, policy, or procedure proposed or followed as the basis of action. That is a theory. So now let's discuss, what do you think are some of the purposes of theories in education? Purposes of theories in education. We have looked at what a theory is. So based on what we have discussed so far, what do you think is the relevance of theory in education? Is it even important for us to study theories? Purposes of theories. Okay, so there are several hands up. Mr. Ebenezer Sam.
Hello. Yeah.
Yes, please.
Please, it helps us to actually identify one's understanding on a particular topic or subject.
Okay, so it helps us to understand a particular course or subject. Okay. Mr. Abbas Abubakar.
Madam, please, it serves as the guidelines to, or just the basics to every new idea concerning the
Okay,
topic.
it serves as a guideline. Okay, okay, all right. And let's take the last one from Mr. Daniel. Mr. Daniel.
Theories help us to know exactly what problem we are researching into and what has already been said about that.
Okay. All right. So in addition to what they have said, in education, nursing theory was used primarily to establish the profession's place in the university. It serves as an excellent help to the development and expansion of knowledge and support in different features of learning. So we'll get to know of the various nursing theories, and I would appreciate the fact that it has guided or it guides even in developing curriculum in the educational setting. And then in research as well, nursing research identifies philosophical assumptions or theoretical frameworks from which it proceeds. So you realize that when you are carrying out research, sometimes you have to look out for some theoretical models that have been propounded, and then you see how best you can apply it or link it to the research that you are undertaking. Then the purpose of theories in our practice. Lesson theory is a useful tool for reasoning, critical thinking, and decision-making in nursing. So I think one of your colleagues mentioned that as well. So it gives direction and purpose to the nursing practice. And then it also helps to improve the quality of care we render to our patients. So that is the purpose of theories. Now we are going to look at how we can, we'll look at the characteristics of theories, then we'll see how we can develop a theory. If we want to develop a theory, the sequence or the steps in which we'll have to follow in order to develop a theory. So the characteristics of a theory. So theories are made up of interrelating concepts. They are made up of interrelating concepts. So when you take a particular theory, you'd realize that there are several concepts in the theory, and then these concepts are somehow or some way interrelated. Theories are logical in nature. They are logical in nature. So when you take every theory, you should be able to make meaning or sense out of that theory. Theories can be generalizable. So let's say when you take a theory which applies to when you are carrying out your research using a particular theory which applies to our setting, our Ghanaian setting, we should be able to make inference or generalize whatever findings we have arrived at. Given the same population in a different country, we should be able to make we should be able to generalize our findings. Theories also serves as basis for hypotheses that can be tested. Theory serves as basis for hypotheses that can be tested. Example, when we take Florence Nightingale's theory, if you remember the definition of nursing, according to Florence Nightingale, she mentioned that it is the act of utilizing the environment of an individual to bring about the recovery. So we can get a hypothesis or have a research question from this theory, from her theory, and then we can hypothesize that an unclean environment can bring about ill health. We would want to find out if this statement is true. So we can carry out a research given to sample or given to population. We will expose a particular group to unsanitary environment, and then we'll expose one to a very clean environment, follow them for some time, and then we will see if indeed what Florence Nightingale has said is true. That's even if someone is sick, and then we make the environment clean, that alone can bring about the recovery of the person. So a theory forms a basis for hypothesis that can be tested. Another characteristics of a theory is that it increases the general body of knowledge within the discipline through the research implemented to validate them. And then theories can also be used by practitioners to guide and improve their practice. And then when you take a theory, it is also consistent with other validated theories. So these are the characteristics of a theory. Theories are made up of interrelating concepts. They are logical in nature. Theories are generalizable. They serve as basis for hypotheses that can be tested. And then theories are used by practitioners to guide and improve their practice. So let's see how we can develop a theory. Theories usually begin with an assumption or hypothesis. So before you can develop a theory, you should have a guess. Remember we said that assumptions, they are like guesses that we make which have not been tested but are true. So if you want to develop a theory, before you can develop your theory, you should have an assumption, or there should be a guess or hypothesis. And after you have your assumption, you would want to restructure your assumption. Usually at the raw state, your assumptions might not really be meaningful, but you read around what your assumptions are, then you restructure your assumptions through a creative and rigorous way in order to make it meaningful. And after you have restructured your assumption, you would now want to test the assumption or the hypothesis, and then you validate it through research. So one, you should have your assumption or your hypothesis. Then you restructure your assumption to make it meaningful. Then you carry out a research to test your hypothesis or to validate your hypothesis. And after you have carried out your research, you now come out with findings from your research. And then the findings of this research now forms a theory. which in effect will form the basis for our nursing. So that is the steps in which we can develop a theory. So it is systematic. You can't just have an assumption and then based on your assumption, you just come out to say that I have a theory. No. After your assumption, you have to restructure your assumption. Then you carry out your research to test your hypothesis to see if you will accept your hypothesis or you reject your hypothesis. And the findings from your research will now form the basis or will now be the theory that you have propounded. So that is the steps in which theories are developed. Please, to this point, do we have any question before we move on to nursing theories? And then we'll look at the importance of nursing theories, the relevance of it, and we'll look at what a conceptual framework is. Okay, so there are several hands up. So the question is directed to the entire class. If the question is asked, I would want to find out how best you have understood. So when the question is asked, we can all contribute. Trying to find those whose hands have been raised. Okay, so Mr. Ebenezer upon Setre. Mr. Ebenezer upon Setre.
Madam.
Yes, please.
Madam, sorry, I had to lower my hand, but
okay.
I forget.
Okay, it's okay. So please, I'm asking for questions. So far, all that we have discussed, if there is any contribution, there is any question, Ms. Dorcas Asmenin.
Yes, madam.
Okay. Please, any question or contribution? Ms. Dorcas, please, are you still with us? Maybe she's having a network challenge or something. Mr. Eric Okotu. Mr. Eric.
Yes, madam. Please, can I be heard?
Yes, please.
Okay, please. In the explanation, we've talked about 4 steps in the development of a theory. I humbly want to find out the second step says that the assumption is then restructured through a creative way. Can you throw more light on it, please?
Okay, so let me just give an example. I don't know if you remember your days at the nursing training. I believe you did research, right? Mr. Okutu. Okay, so usually at the raw state, sometimes the idea is there, but as to how to even coin your hypothesis becomes a challenge. So we said that the first step is that there should be an assumption. So once you have the assumption, that is the raw state of whatever idea you have. So now you have to think through and then restructure, put your thoughts together. Something like coin something from the raw idea that you have to make it very meaningful. So that is what we mean by restructuring the assumption. Mr. Okoto, please, is it clear? Oh, I don't know if he's still with us. Okay, Miss Winifred.
Okay. Hello, madam.
Yes, please.
Please, my question is about the proposition.
Okay.
Please, when you're explaining, you said it consists of 2 or more, having 2 or more phenomena. But on the slide, it
was
saying
concept.
that they have concept. So I was a little bit confused.
Yes. So it's either way. Once you have the phenomenon, you try and then you come out with the concept. If you followed, I cited an example. Let me see if I can get that example, where we first had the phenomenon and then derived the concept out of it before we had we used the proposition to explain. Let me see. Okay, so we have a situation whereby someone loses a loved one, and then the person becomes helpless. Someone loses a loved one, and then the person becomes helpless. So losing the loved one is a phenomenon. And then we can get two concepts from this given situation, and that would be helplessness and then the concept of loss. So I can have my proposition to be multiple losses predispose one to a feeling of helplessness. So I'm trying to, so it's either way. It can either be for the phenomenon or the concept. And then as we know, we derive the concept from the phenomenon. So please don't be confused. It can be either way.
Okay, thank you.
You're welcome. Is any other question? Any other? If not, then we'll continue. All right, so next we are going to look at nursing theory. So it's when we say nursing theory, it's just about all that we have discussed about theories, applying it to nursing. So nursing theory is developed to describe the phenomenon. The phenomenon is nursing. So nursing theory describes all the processes, occurrences, and then events that happen in the nursing profession. And the nursing theory differentiates nursing from other disciplines. It's therefore fundamental to effective nursing practice and research. So nursing theories differentiates nursing from other disciplines and activities. So just as we have discussed the importance of theories, some of the importance of nursing theories is that it helps nurses to understand our purpose and our role in the healthcare setting. Nursing theories helps us to understand our purpose and roles in the healthcare setting. Theories also serve as a rationale or scientific reasons for nursing interventions. If we follow the steps for developing theories critically, we remember that we mentioned that before we can have a theory, after you have your assumption and then you rigorously restructure your assumption, you now have to test and validate your assumption. So you have to carry out a research before you can arrive at a theory. So it provides us with a scientific reason or rationale for our practice. The nursing theories also provides foundations of nursing practice. It helps generate further knowledge and indicates in which direction nursing should develop in the future. It also provides nurses with a sense of identity. Nursing theory can help patients, managers, and other healthcare professionals to acknowledge and understand the unique contribution that nurses make to the healthcare service. So there are several importance that you can think of in relation to our profession. So just as we saw the relevance of theories in education, research, and practice, when we take nursing theories in practice, it helps nurses to describe, explain, and predict everyday experiences. So once there are theories that have been propounded on certain things that we do in nursing, it helps us to explain whatever we are doing in our profession. Nursing theories also serve to guide assessment, interventions, and then evaluation of nursing care. It also provides a rationale for collecting reliable and valid data about the health status of patients. And then it also helps to describe the criteria to measure the quality of nursing care. So that is nursing theory. Now, there is a slight difference between nursing theory and the nursing model. So before the existence of nursing theories, we had what we call models. And then McKenna stated that models assist practitioners in organizing their thinking about what they do. And this transfer of thinking into practice benefits the patients and then the profession. So with the model, by virtue of your experience, the experiences that you have gained in your day-to-day activities on the ward, it gives you a better perspective about how you think about your perception or how you think through in given situations. So models assist practitioners in organizing their thinking about what they do. And this transfer of thinking into practice. Miss Martha, please check your end. We can see some lines on the slide. Miss Martha. So some authors accept that models are the appropriate precursors of theory. So some authors also believe that before you can have your theory, you can have your assumption in the form of a model. So the essence of the models are believed to lead to the identification of concepts and assumptions. And that when they are tested by research, they lead to formation of theory. So some authors are of the view that before you can even have your concept or before you can have your assumption, you should have your model. Then once you have your model, you derive your assumption and you test your assumption by research, then you can now formulate your theory. So let's look at a typical example of a conceptual model. So a conceptual model refers to representations of an idea based on your own understanding or your perception of a person or researcher on a certain topic. So let's say, based on your practice or having gained so much experience on the ward, I can have given hypertension. I can come out with my conceptual model that when we have an individual and that this person has a high blood pressure, one of the means that we can carry out to lower the person's blood pressure other than taking medication will be to engage the person in a physical fitness exercise. So that becomes my conceptual model. So if you can see from the screen, that is how I have drawn my model. That's physical fitness or some form of exercise can help lower a person's BP. So we'll pause here and then we will try and then come out with our own conceptual models. So we are saying conceptual models refers to representation of an idea based on your own understanding on a particular topic, phenomena, or theory. So please, let's come out with our own conceptual model. So I've given a typical example that's given the topic of high blood pressure. I can come out with my conceptual model based on my experience that when a person has a high blood pressure, as one of the way to, when you are talking about hypertension, we do mention lifestyle modification. And then one example we can give will be to engage the person in some form of activity or exercise. So I can come out with a conceptual model that one way in which we can reduce or lower blood pressure will be some form of physical fitness or exercise, depending on the person's condition or as the person's condition will allow. So please, we'll pause here and then we'll take examples on conceptual model. So we have, oh, it's almost always the same hand. Okay, Miss Annabelle Amponsa. Miss Annabelle Amponsa. Miss Annabelle Amponsa. Miss Annabelle, please, you can unmute yourself and then talk. If she's not ready, then can we have, okay.
Please, a person and then diet control.
Okay.
And management, weight loss.
So how will you link it?
Okay, so when an individual have management in his or her diet control, it can help in losing weight.
Okay, so proper what dietary management and bring about what weight control, effective weight control. Okay, all right, thank you. Miss Agnes. Miss Agnes. Miss Agnes.
Yes, please. I was considering an obese patient. If you want to control her weight, you either put her on some form of physical exercise and then dietary regimen in order to achieve your weight loss or weight control.
Okay, thank you. That's a wonderful submission. Miss Rita Asabiamante. Miss Rita.
Okay. When it comes to stress management, for someone who is able to get enough or adequate sleep during the night can relieve the person's stress.
Okay. Okay. Thank you. Let's take the last two examples, then we continue. Miss Sidonia. Ada.
Please, madam, a person sleeping under treated mosquito net will prevent malaria.
Okay, so you are taking us to the preventive aspect. All right. So sleeping under insecticide treated nets. Well, so usually for this conceptual model, we usually want it's usually about how we can manage a given condition than the preventive aspect.
Okay.
So even with in your scenario as well, it can be that a person has the condition. So if the person has malaria, we still educate the person on what he or she can do so as not to get the condition again. So your scenario still holds. It still holds. All right, thank you. Let's take the last one from Mr. Samuel Abropa.
Hello.
Yes, please.
Yeah, sister, a client who is anxious, okay, and then you encouraging the client to verbalize fear and then reducing the cause of anxiety.
Oh, okay. Okay. All right.
Thanks.
Okay, thank you. So we've understood what conceptual models are. Any question? Any question? Any question? Let me see if we have. Okay, so next we are going to look at meta paradigm. we are done with the theories. But for the purpose of, I can see some hands raised. Okay, please let me call them before we continue. Miss Salome. Miss Salome. Okay, Mr. Daniel. Mr. Daniel. Yes,
please.
please.
With conceptual one, the example that you give, and I don't know whether the management, you said we are looking, this one we are looking more of management than preventive.
Yes.
So I want to know whether like the medical aspect of the management is also included in this one, or is only the lifestyle modification management that we are looking at.
So this emphasis is on the lifestyle modification or the nursing management, let me put it that way, than the medical aspect. So least is in regimen.
Okay. Thank you very much, madam.
Miss Okay, Miss Mary Okran. Miss Mary Okran.
Hello, madam. Please, can you hear me?
Yes, please.
You said about the conceptual models. We are talking more about the management, not the prevention.
Yes.
But can I suggest that feeding a child with nutritious milk can help lower malnutrition cases in children?
Yes.
Okay.
Yes.
Okay. And madam, please, I have some plea. We couldn't join, some of us couldn't join the class earlier due to network issues. So if
okay. Definitely,
okay.
sorry to cut you short, but definitely, usually at the end of every class, we have a summary.
Okay.
And then by way of summary, your colleagues will tell us what they heard from the beginning of the lecture. So we'll tackle those areas that you missed out on. And then when you get the lecture notes as well, when you read and then you don't understand a particular point, you can always contact me for further explanation.
Okay, thank you, madam.
Miss Annabelle, please, your hand is up. Okay. All right, so let's continue. We are going to discuss metaparadigm. Metaparadigm. As part of your presentations, you have to let us know what your metaparadigms are according to your theorist. Please, can you see my screen? Okay. All right, please, I've had the feedback. Let me share. Okay, so when we say metaparadigm represents a world view of common concepts in nursing. So globally, when you have people's conception or how people see various concepts in nursing is what we refer to as a metaparadigm. It represents a worldview of common concepts in nursing, and it guides the development of theory in nursing. So metaparadigm is the unifying force. It is the unifying force in a discipline that names the phenomena. Metaparadigm is the unifying force in a discipline that names the phenomena. So when you take the word metaparadigm, it originates from two Greek words, meta, meaning with, and then paradigm, meaning pattern. So nursing metaparadigm, simply put, we will say with pattern. So it's the unifying force in a discipline that names a phenomena. So there are four major concepts in nursing. When you hear of the metaparadigm for nursing, it stands out for four major concepts. And then we have person, environment, health, and then nursing. Person, environment, health, and nursing. So in your presentations, you realize that most of the theories try to let us know who a person is in their theory. They will also let us know what the environment stands for. And then they explain what health is. And then they define what nursing is. So we expect that as part of your presentation, you should be able to let us know how your theorists define or sees these metaparadigm. So metaparadigm of nursing refers to or stands for person, environment, health, and nursing. And these are the four major concepts of nursing. And we are saying metaparadigm is the unifying force of nursing. So we'll take each of them and then we'll see what goes into each of these concepts. So the first concept is person. Person. So in nursing, when we say person, we know it's the patient or the recipient of nursing care. Sometimes it goes beyond the patient. It can be the individual, the family, group, and then community. So in your presentation, let us know what your theory means by person. Is the theorist making reference to the recipient of the direct care, which is the patient, or it goes a step forward to include patients, relatives, or other family members. So person is the recipient of nursing care. Then the next concept or metaparadigm is environment. Environment stands for the internal and external surroundings that affect the patient. So the external surroundings, we can have the physical environment. The physical environment. Aside our immediate environment that we can think of, we can also consider the family, the friends, and significant others as part of the external surroundings. All these people or all these things in the environment in a way can have an influence on a person's health. Then the internal environment has to do with what goes on within the system of the person. I don't know if you remember homeostasis in is it anatomy and physiology. We learned that when there is an equilibrium between the internal and then the external environment. So internally too, we have to consider the internal environment. As when things do not go on well in our internal environment, it can also bring about ill health. So with the environment being the next metaparadigm of nursing, it considers both internal and then the external environment. The next concept is health. Health has been defined as the degree of wellness or well-being that patient experience, the degree of wellness or well-being that patient experiences. Then nursing. So nursing is the science and art of the discipline. The art and science of the discipline. The discipline here is nursing. So most of the theories, every theorist and how they see their perception about nursing. So realize that in the theory, you coming out with the various definitions that each of the theories comes out with. So the attributes, characteristics, and actions of the nurse providing care on behalf of or in conjunction with the patient. So that is nursing. So these are the four main concepts we have discussed: the person being the recipient of care. We have the environment. We have discussed that it can be the internal or the external environment. And we have health. We've discussed health as the degree of wellness or well-being of an individual. And then the last concept is nursing. That is the science and art of the discipline. And I said that each theorist has his or her own way of defining nursing. So in your presentation as well, you have to let us know how your theorist has defined nursing. Please, to this point, any question? Let me unmute the class. The next thing we have to discuss has to do with the history of nursing theory. But I'm going to give that to you as a reading assignment to read. We'll discuss that next week, God willing, the history of nursing theory. So let me unmute you all to this point so that we can, if there are questions or clarifications that need to be addressed, we can. Okay, so now you can, Mr. Derek Entry.
Yes, sister.
Yes, please.
If my was a question.
Okay.
During the assumption stage, I had a question, but you couldn't give me the opportunity. Thanks for the opportunity. I was trying to add a contribution that in diagnosing a
Please, can you position yourself well? Hello.
Hi, please. Can you hear me?
Yes, please.
Okay. My question was about the assumption. I was trying to ask that we know in diagnosing a patient, we mostly start with history taking, and that you can take, for instance, signs and symptoms of these patients in diagnosing them before we go for this laboratory investigation to confirm or confirm our final diagnosis. Trying to add that during these signs and symptoms, can we say that they are assumptions? These signs and symptoms are assumptions because they help in diagnosing the patient. For example, if the patient has headache, severe headache, the patient is vomiting, he comes with high body temperature, he gives all this history, and that before the doctor will request this investigation, he can make this provisional diagnosis that suspect that the patient is having what may be malaria. So can we say they are assumption?
Yes. So with this, it will be a general example of an assumption. but in respect to theory development, it might not be applicable, but that is a general example of an assumption.
Okay, thank you.
You're welcome. Mr. Derek, entry. Or you are the one who just spoke?
Yes,
Okay.
please.
Okay. Miss Rose, thank you.
Hello, madam.
Yes, please.
I just wanted to ask a question on the steps of nursing, the concepts of nursing, where we had the personal, environmental,
Okay,
health
the 4 major
nursing.
concepts. Okay.
Yeah, madam, please, you made mention of 4, but there is a last one under, which is the attribute. That one, when it adds to 8, it becomes 5. So I want to ask whether it's part or it's just explaining the nursing.
Please, which attributes?
Please, under nursing, after you explain the nursing, there is attributes. The next step was attributes.
Hold on, no, Technospark, check. The one whose phone is Technospark, please check. Yeah, getting some lines on the slides. No, the attribute is not part. The Metaparadigm, there are 4.
Okay.
Yes, there are 4.
Yes,
We
please.
have the 4 major concepts. So we have the person, health, environment, and then nursing.
Okay. Then, madam, please, at first, I wanted to ask a question, but I wasn't granted the permission. I wanted you to...
can ask.
Okay. Please, I wanted to ask if assumption is the same as hypothesis.
Yes, please. Yes, please.
Okay. Okay. Thank you.
You're welcome. Mr. Daniel.
Yes, madam. One of my brothers just asked a question concerning that signs and symptoms, and then making provisional diagnosis. I wanted to say that the provisional diagnosis, that one can be the provisional diagnosis can be your
Hello. Mr. Daniel. Mr. Daniel. Okay. Mr. Daniel, are you still with us? Okay, Miss.
Hello, madam. Is the network?
Yes. Oh, okay. So as he tries to get a stable network, let's take from Osei Martin, Mr. or Miss Osei Martin. Osei Martin. Miss Esther, Miss Winifred. Miss Winifred, can we hear from you, please?
Okay, madam. We wanted to ask about the concept of lesson, the environment. Aside from family constraints and the person's environment itself, like the condition of the home or the condition of the community.
Yes, so the immediate environment is also part. So you can think about all those factors in the environment which can directly or indirectly affect the person's health. They are all considered as part of the environment. Thank you. Please come again.
I can't see your screen.
I've stopped sharing.
Okay.
Yes, we are done with what we are supposed to do for today. So we are allowing for question time. Then we can summarize, and then we bring the class to an end. Okay. So Osei Martin. Hey, whose baby is that? We are in class. Miss Efia Fusia. Okay, so let's take the last one from Mr. Albert Saki. Then we summarize to help those who couldn't join early to also benefit from the class. Mr.
Hello.
Albert, yes, please.
Please, under the component of theory, the proposition part, I had a one that I couldn't understand. So you can cover that.
Please, is it a proposition?
Yes, please.
Okay, so we are going to summarize. We are going to have a summary, and then if it is not captured, I'll explain that for you.
Hello.
Please, is that okay?
Hello, madam.
Okay, sister.
So you let me just mention it for the proposition. Oh, please. Whose background is that? Mr. Atosa. Kindly check your background.
Oh, please kindly mute yourself for us, please.
Because we are having a discussion, that's why I allowed that they could all unmute themselves. But okay. So please, can we have 3 people give us a summary on what we have discussed for today? What we have discussed today, can we get 3 people summarize? And I'll be grateful if you can touch on proposition as one of your colleagues need clarification into that. By way of summary, can we get 3 people? Mr. Derek.
Hello.
Yeah, Mr. Derek, please, you can talk.
Today we look at theory in nursing practice. So we look at the components of theory, which we said we have 4 components. We said phenomena, concept, preposition, proposition, then assumption. We went ahead to say that for the phenomena, something that you can, let me just say, with this thing that you can, like maybe I have smelled it, I have seen it, I have just using any of those sense organs, you can, that is what within the where you find yourself, whether the ward, whether outside, but in our nursing field, let me just say within your ward or where you may be. And we look at the concept, and we're saying that for the concept there, it is just when this phenomena occurs and you can get a name and give to it. That one, you cannot say that is the concept. Giving a name to the phenomena, that is what we can call as concept. Okay. Then when two concepts then comes to, like, 2 concepts occur, like if you're able to link 2 concepts together, let me just say 2 or more concepts. Mm-hmm. That one is what we were saying, that the proposition.
Okay.
Then we went to the assumption, and we're saying that for the assumption, it's just something that, let's say that you have to, it's not like to convince, but it's something that is accepted. Like it is not, it may not be real, but in a way that you can put it and people will see like it is true. Mm-hmm. It's something that is accepted, that it is true, but it is not like
it has not been tested.
It has not been tested yet, but miss. Then we look at the purpose of
okay, Mr. Derek, it's okay, thank you. Let's hear from another person. Thank you, you've done very well. Okay. It's always the same hands. From next week, I'll randomly call people to talk. Miss Amponsa Annabelle.
Hello.
Yes, please.
Please, I want to talk about development of a theory.
Okay.
And then with the development of a theory, you said it usually begins with having an assumption or a hypothesis. And then before you can develop that theory, there should be a test. And then you read about that test, and then you reconstruct it to add meaning to it. And then test your hypothesis typically based on true research. And the findings that can come out, it can be theory.
Sure. Thank you. Thank you, Miss Annabelle. Okay, Miss Winifred.
Thank you.
Miss Winifred.
I'm talking, so we also looked at the purpose of theory. We are saying that it's used in education and it's also used for research. Then for practice, in the practical setting, then we also looked at the characteristics of theory. We said it should be logical in nature. It should also be generalizable. Then it should be a base for hypothesis that can be tested. And it should also increase the general body of knowledge. And it should also be interrelation, like it should be an interrelation concept.
Okay. All right, thank you. Can we have the last person? The last person, please. Okay, Miss Victoria, aye.
And finally, we talked about the 4 Metaparadigm.
Sure.
And we talked about the person, the environment, the health, and nursing, where the third person refers to the nursing, the person normally refers to the patient. And it can be the patient, family, or anything. And a group or as far as the community. And the environment, we talk about the internal and external surroundings. The external being the patient, and the family, or the internal being where you patients and the communications relationship and autonomy because that affects the patient. And we moved on to talk about health being the third one, where we said that health refers to the degree of knowledge that the patient experiences. And then we talk about it.
Okay. Miss Victoria, thank you. So it's been okay, let's take the last one. Mr. Solomon, your hand is up.
Okay, sister, you also made us aware that with the subsequent presentation and the theories that we will be presenting should be in line with the metaparadigm. That is talking about the patient or the person, and also their environment. Then we talk also about their health, and lastly, the nursing. The theory should speak or define nursing. Thank you.
Yes, you're welcome. So, course rep, how far with the division of the class into groups? Is any of the reps here, or has the class been divided? Because I will send the topics for the presentation by the close of today. And I'll add the outline so that you can start working on it. Have you been able to get the class into groups? Do we have any of the reps with us? Mr. Solomon, please, your hand is up.
I needed to lower it, please.
Oh, okay. Okay. Do we have any of the class reps here? The course reps, I asked that you divide, we need 15 groups. We need 15 groups, and then you can do that. You can use proximity-wise too for the division so that they can meet. Because if you mix the centers up, some people will never participate in the discussion. Okay, Mr. Kalaliona. I don't know if I've mentioned the name right. Your hand is up.
Yes, madam. I had want to make some submission, but
Okay.
Well, the last end of your lesson, you have made it that the proximity is a problem. If not, this morning during our research methods lecture, we were divided into rooms.
How many
which
rooms?
could have also helped. I think actually I don't know the number of rooms, but me I'm on room 11.
So
but that one does not include the proximity.
Is it breaking you into rooms on the Zoom app?
Yes, please. Yes, please.
That one doesn't take into
with the proximity issue, I think is an important point, because
yes,
if somebody is at Kita and somebody is at Tamale, how do you meet to have one discussion? That would be a challenge.
So with this, I was hoping that if the reps can center, yes, please.
Question for Kumasi campus.
Hello, madam.
We are still compiling. Hello.
Please, there is someone talking. Hello.
Hello, sister.
I don't know, but I do that.
Please,
Miss
if you are
Mary
not
Mason.
talking,
Hey guys, please mute your mic, please.
If you are not on board, kindly mute yourself.
Okay, so the course rep, Mr. Daniel, please, your hand is up.
Madam, I wanted to say that like those groups that they said we've already created, and I think some of us were not able to join.
Okay.
I think the division. I saw the pop up on my phone. I tried to join. I think about twice. It took me somewhere, and I even battled before joining the class again.
Okay,
so as it stands, I think and not me alone. I think most of my colleagues have not been able to join any of those rooms that they are talking about.
Right.
So if we create groups, it will be good.
Okay, Mr. Adoliba. Mr. Adoliba, are you? So I was saying that if the course reps, the center reps can help us.
Yes.
I think that would be better.
That would be better.
If yes, you are able to meet, and then you can even form. You can use that as your for group discussions as well.
Yeah.
For your personal studies. If you are closer to each other, you can always find time, and then you meet. If not in person, you can even meet on Zoom or something. But once you are closer, occasionally you can meet in person, and then and even study together, if not for the presentation.
Yeah.
Mr. Adoliba, please, your hand is up. Okay, Mr. Bobby Godfrey. Pass rep.
Madam, this is Godfrey.
Okay.
Of Mercy.
Mercy.
Yes. The group, we started with compiling the list.
Okay.
So we suggested every course rep for the various campuses submit a list of the individuals and then the total number.
Okay.
So, but now our campuses keeps on increasing, the number keeps on doubling every day. So we are yet to come with an actual figure. So as it stands, we don't know the exact number a campus holds.
Mr. Godfrey, if we are to wait, that might delay us. So whatever you have currently, let's go by it. Okay. As and when we have new people joining us, we'll add them on to the groups.
All right. So
that will help.
In the group, how many students do you want in the group, please?
I want 15 groups in all. 15 groups in all. With that, so I'm sure the entire group is more than 200, right?
Okay, yes, please.
Let's see. You can work with what you have now, but I will still make the the topics available, and then I will add the guidelines as to how you should have it done. All right. Okay. Amdalatu, please, your hand is up. Miss Amdalatu Ibrahim. Or Miss Wendy or Parry. Okay. So it's been an interactive session, and then we'll bring the class to an end at this juncture. Hopefully next week we will continue the class. So I'll send the lecture notes. Then if you want any clarifications, you can just send me a personal message, and then we'll take it from there. So enjoy the rest of the day until we meet next week.